another service we would like to showcase, and we're very proud of, is our children's services. To complement the women's services, we have to be able to provide good care to our pediatric population, so it becomes a family, a one-stop shopping, and it becomes a family type care. Pediatrics at our Rahba over the years also has shown tremendous volume growth from outpatient services, significant growth, outpatient services, inpatient admissions, tremendous growth, and also, of course, our neonatology unit, which is a very critical service to this community. And so I'll talk briefly again about some of the performance improvement projects we're putting in place in terms of addressing issues of access, issues of timeliness, issues of productivity, issues of continuity of care. And so the pediatric department in our Rahba is the first outpatient service where we've been able to implement an open access and redesign program. What this program does is that it looks at 4 critical elements. One is that the patient comes in and sees the same provider on every visit, except the patient chooses not to see that provider. That will maintain continuity of care. 2, that in itself will reduce the cycle time, and the cycle time is from when the patient enters our door till the patient exits. We want to reduce the cycle time. We also want to reduce the wait time. And the wait time is when the patient has fully been registered and just waiting to see that provider. And then most importantly, the patient satisfaction. Studies have shown that patients are more satisfied if you take care of their wait times, their cycle times, and of course they see the same doctor that they know and they like. So we did implement this in outpatient pediatric services. And so significant increase in the volume and in the satisfaction, patient satisfaction surveys. In addition to that, so we don't send our patients running around shopping for health care when it could be delivered to them right here at our Rahba, we initiated the pediatric vaccination program, first ever, 2 years ago, where the children come to our Rahba and they're entitled to have their vaccines, they get their vaccines. And this is done mostly through what we call the health passport, which gives the patient, empowers the parent as to what standards, evidence-based standards are out there and what their children deserve. And so from vision screening, which we put in place, to dental care to avoid dental caries, we've put all of that in place, and we're very happy so far with our program. Neonatology, because we don't just serve patients who are born at our Rahba, for many reasons end up in the neonatal intensive care unit. We do accept patients. We collaborate with our sister hospitals such as Corniche. We collaborate with the rest of the SEHA hospitals, and also with non-SEHA hospitals to accept patients to our NICU. We were running an average of 16, 17 patients a day in our NICU, but we're also very happy to say, because of so much demand and need for that service, we newly opened a state-of-the-art, like never anywhere seen before, in our hospital. And so we've expanded that neonatology unit now from 17 to 33 cots. Well managed. We have highly skilled nurses, allied health, and doctors in there to provide good care to our patients. And we're quite happy that this is one of the showcase service at our Rahba Hospital. I also want to conclude by saying that we are very proud that our Rahba Hospital, as part of the SEHA healthcare system, in the community, has been able to recognize that our community deserves 7-star service, and that we will not stop. We will continuously attempt to get to the 7-star level, but it is our responsibility to ensure that every patient who leaves our Rahba Hospital gets safe care, timely care, in an efficient manner, effectively, equitability, because everyone deserves to have the same care. And the center of all of this is our patient. And we're very proud that that is our focus here at Rahba.